eHealth Africa for 2017, we had a huge impact across all of our country offices. In Nigeria, we continued fighting the polio response. We are very excited that we have no new cases this year. And then in Sierra Leone and Liberia, we worked on strengthening health systems after the Ebola outbreak. We've really worked on improving their health information systems and improved on making sure that we can detect a disease before there is an outbreak. Everybody at eHealth Africa has a huge impact on improving healthcare systems in Africa. From the drivers who get us where we need to go, to the cleaners and the groundskeepers who keep our campuses looking beautiful, to the finance and the HR team that make sure that we can always have the logistics that we need to operate, and then from our project supervisors and project managers in the field who actually are working to improve healthcare systems. Everybody has a huge impact and everybody gets to play their own role in improving eHealth Africa.
Here in finance, we support the implementation of all the projects we have in eHA here. What are the projects? We presently are going through implementing GRID project, the polio project, polio eradication project. We have VDD, we have IVL, we currently have M&A, and some others like JSI, MNCH that we are implementing in Bauchi and Sokoto states. So how do we do this support? We support by making prompt payments to the vendors and also the implementing field officers.
I provide logistics support, accommodation, ground logistics, visas, and any other trip-related activities. I transport our staffs to different countries, both international and those who travel within the state. And also they get the best travel services. Air travel, we use the best airlines, and I think we have the best of cars, which they are comfortable traveling with.
I am responsible for supervising the GIS technical team. This year I have worked mainly across 3 program or impact areas in the organization: the public health and emergency management systems, disease surveillance, and health delivery systems. I also lead the geodata management project team, mainly responsible for planning, developing, and managing the enterprise geodatabases that support the various programs and projects across the organization.
One of the activities we perform is to ensure that every single child is vaccinated in every round of IPD campaigns each month. And as you can see, we're in the store where all the materials and equipment we use for tracking of vaccinators are kept. This is where our generators, phone trackers, and the bags we use for all these activities are kept. Now, what we do every time is to ensure that when the vaccinators go out to do their work, we try as much as possible to use our own equipment, which is technology, to identify where they actually go each day for their activities. Doing this helps us to identify any settlement that is missed so that we can ensure that those children in those areas are properly vaccinated and ensure that not a single child is missed.
Our mission is to ensure that vulnerable households have sufficient food and nutritious food to live healthy lives. Our projects are actually evidence-based. We ensure that our projects are targeted at the people who need them the most. One of the projects we've recently implemented is the Orange Flesh Sweet Potato Project. To provide a little bit of background, I would start with what vitamin A is, because OFSP is rich in beta-carotene, which is a precursor for vitamin A.
Our focus in the software team is to develop applications that satisfy the requirements of clients, both internal clients and external clients. And we have a very large development team, not very large development team, consisting of software developers, project managers, business analysts, quality assurance engineers.
So we monitor projects, we ensure it's well implemented, and then we also evaluate. So like I said, monitoring, evaluation, and research. The monitoring aspect is we ensuring that projects are implemented as expected. Okay, and then when we see that some things are going wrong, maybe it's not going as it has been planned, we put some measures to see that it falls back in line.
This is eHealth Africa Research Laboratory. It's a public health research laboratory, and currently we have 2 projects running to investigate infectious disease in pediatrics, that's children under 5, and also the IM chip, which is for sickle cell anemia detection in children. The idea is to have an equipment that can rapidly detect sickle cell anemia in children as early as from 6 weeks old.
We are to ensure that all the staff in eHA have been picked to the office on a daily basis. We pick them in the morning from their residence, then in the evening time, we take them back to their residence. And I'm in charge of all the drivers, the vehicles, and every other thing that has to do with fleet department. And here, on this screen, we have what we call Fleetio. Fleetio helps us to monitor our vehicle. This is where we input all the details of all eHA vehicles.
Looking forward to improving how we manage our employees and the performance of how we improve our projects to make sure that they have the biggest impact. The second is on improving 2 of our newest and smallest program areas. The first one is laboratories. We're excited about the new laboratory that we have at the eHealth Africa campus in Kano, and we're looking to build up the capacity that we have there and the number of labs tests that we can perform.
À eHealth Africa, on résout les problèmes qui nous permettent de se développer. Meaning, in eHealth Africa, we resolve problems that allows us to grow.
eHealth Africa is a great place to work.
eHealth Africa is exciting. We're doing lots of great work with lots of great people.
I love eHealth Africa because it's a melting pot of incredible people.
There's so much to say about eHealth Africa, I cannot coin it in one sentence.
eHealth Africa is superb.
eHealth Africa is a team.